Hello and namaste, listeners, and welcome to the Kapil Gupta Career Pod Show, where we explore inspiring careers and help you discover your future path. And I'm your host, Kapil Gupta. Imagine being a detective, not of stolen jewels, but of diseases, tracking invisible viruses, uncovering patterns, stopping outbreaks before they grow. Sounds heroic? Well, that's exactly what an epidemiologist does. Now, they are the unsung heroes who safeguard our communities by investigating the spread of diseases and designing public health solutions. So, Gen Z, if you love science, want to make a difference, and dream of a job that's more than just 9 to 5, stay tuned. This episode is your passport to a career that's as cool as it's crucial. So, hello all. I'm Kapil Gupta, founder of Study Abroad Academy. I'm on a mission to coach and mentor 100,000 high school students and help them realize the dream of studying in the best universities of the world and build happy careers for themselves. So, today we are diving into the world of epidemiologists, the real life detectives who track down diseases, stop outbreaks, and keep the world safe. And if you've ever wondered who figures out how to stop the next pandemic, well, it could be you. So let's talk about the scope. Because let's be honest, we all want to know, is there scope in this field? Or will I be stuck at home scrolling memes? Good news. The demand for epidemiologists is booming both in India and abroad. And thanks to the COVID 19 pandemic, everyone now knows how important it is to have experts who can track and control diseases. India's vast population, varied lifestyle, and diverse environments make it a prime area for epidemiology work. Now, government organizations like the Indian Council of Medical Research and National Center for Disease Control hire epidemiologists for disease surveillance, health policy, and outbreak control. Moreover, global or non profit agencies like WHO, UNICEF, Gates Foundation often recruit epidemiologists for global health initiatives. The COVID 19 pandemic emphasized how critical their role is. India's strong biotech and pharmaceutical sectors also need epidemiologists for clinical studies and vaccine trials. And abroad, opportunities are vast in healthcare, academia, research, and consultancy. Countries like the United States, UK, Canada, and Australia hire epidemiologists in public health departments, universities, CDC, NIH, CDC London, and global organizations. And if you dream of a role with global impact, tracking emerging diseases, shaping public health policies, or working in emergencies, then epidemiology places you at the front line. Basically, wherever there are people and diseases, there's a need for them. And with new diseases popping up and the old ones making a comeback, the world needs more disease detectives than ever before. So now you must be thinking, what does an epidemiologist actually do? Will I be wearing a white coat and running around with test tubes? Well, not exactly, but it's just as cool. So let's understand, what does an epidemiologist do on a typical day? 1. Disease surveillance. They collect and analyze health data, tracking infection rates, vaccination coverage, and mortality trends to identify outbreaks early. 2. Outbreak investigation. When cases spike, epidemiologists go into the field, collect patient data, interviewing contacts, taking samples to determine the cause and chain of transmission. And number three, designing public health interventions. They plan vaccination campaigns, health awareness drives, and prevention programs, for example, for diabetes or cancer. The number four, conducting research. They study how diseases spread, risk factors, and effectiveness of treatments, publishing research to inform global health guidelines. And number five, collaborating with stakeholders. They do listening with doctors, hospitals, labs, statisticians, policymakers, and international agencies, guiding decisions to support communities. And if we talk about the workplaces, government health departments, hospitals and clinics, labs and universities, NGOs and global health organizations, then pharmaceutical companies like for the vaccine trials, drug safety, etc. So you might work in an office or lab, but sometimes you'll be out in the field, maybe even in a remote village or another country, tracking down the source of an outbreak. It's research, adventure, and impact all rolled into one. So now let's talk about the skills and educational qualifications needed. So first, let me talk about the essential skills. So analytical thinking. Use stat software, that is R, SPSS, or Stata to interpret health data. The number two, attention to detail. Precision is key when tracking cases and trends because one missed clue can mean a missed outbreak. Then communication. Write clear reports and share findings understandably with stakeholders and communities. Then fieldwork aptitude. Be prepared for travel during outbreaks, sometimes even in remote areas. Then ethical handling. Patient privacy and regulated research conduct are vital. Then teamwork. You'll work with doctors, scientists, and policymakers. Then definitely you need to have computer skills because data analysis is a big part of the job. And finally, curiosity and passion for public health. Then let's talk about the education path and we'll begin with the undergrad degree. So you can do BSc in biology, life science, statistics, or public health. Number two, master's degree. Now that is highly recommended. MPH in epidemiology or public health, or MSc in epidemiology or biostatistics. The number three, PhD for careers in research and leadership. It's optional, but of course valuable. And number four, certifications and online courses, epidemiology courses via Coursera, edX, or John Hopkins to strengthen credentials. Then let's talk about the top institutes. In India, AIIMS Delhi because it has MPH programs. Then Tata Institute, Mumbai, once again for MPH and fieldwork. Then PGIMER Chandigarh for advanced research. Then Christian Medical College, Vellore. Talking about abroad, John Hopkins University in United States, a top-ranked epidemiology program. Then Harvard T.H. Chan School, USA, once again known for global public health programs. The London School of Hygiene and Tropical Medicine based in UK, once again known for public health, and University of Toronto, Canada, known for epidemiology courses. Okay, so let's talk numbers because passion is great, but paisa is important too. So in India, entry level epidemiologists can expect salaries starting from 4 to 7 lakhs per year. With experience and high qualifications, this can go up to 10 to 20 lakhs per year, especially in top government agencies, research institutes, or international NGOs. And then in the senior roles, like for research heads or public health officers, it can go somewhere between 20 to 30 lakhs per year. Talking abroad, in the United States, average salaries range from $60,000 to $100,000 per year, depending on experience and location. Then in the UK, epidemiologists earn between £30,000 and to £60,000 annually. In Australia, salaries can range from 70,000 Australian dollars to 120,000 Australian dollars per year. Of course, salaries depend on your education, experience, and the organization you work for. But one thing is clear: epidemiology is a well respected and well paid profession worldwide because they earn well due to their crucial public health role. So, now let me share a career template, that a step by step guide to becoming a trained epidemiologist. So, step one, the undergrad degree. So, you need to have a BSc in science or public health. Number two, you move on to do internships. So, with health agencies like ICMR, NCDC, or WHO. Then go for the master's degree. So, MPH in epidemiology or public health. Then go for certifications. So, ICD certification, leadership, or GIS. Then for the entry role, you need to have like data analyst credentials. You can be a health officer, work as a research assistant. Then need to have field experience because you need to have outbreak response or work in the community programs. Then moving on to the advanced degree. So PhD or any other advanced specialization will be preferred. Then when you are in the leadership role, then you are in the public health strategy or in the NGO leadership. So, continuous learning is part of this profession as well. So, you must be attending workshops, conferences, specialist certifications, and then you move on to become a mentor or leader. So, you guide new epidemiologists, shape health policy. So, there you have it, friends. Being an epidemiologist is not just about fighting diseases. It's about protecting entire communities, countries, and even the world. It's a career that combines science, adventure, and service. So, whether you want to work in India or travel the globe, the opportunities are endless. And who knows, maybe the next time the world faces a health crisis, you'll be the hero everyone looks up to. So, if you're someone who loves science, cares for humanity, and wants to play a vital role in solving real world problems, this is your calling. So, for the call to action, explore the MPH programs, apply for internships or volunteering in public health, learn statistics, Python, and public health tools, follow organizations like WHO, CDC, ICMR, and of course, share this podcast with friends who care about science, service, and impact. So, your passion for science can become a mission to save lives. As an epidemiologist, your work will matter, not just in labs or classrooms, but in communities that depend on your expertise. Embark on this journey and let your small steps become waves in public health. So, thank you for joining the episode. Follow the Kapil Gupta Career Pod Show for more career insights with real world impact. So, until next time, stay curious, stay compassionate, and stay healthy.